All, this is Dr. Mobeen Sayed from drbeen.com. This is the second show for today. Welcome. And this is my favorite part of the discussion as well. Hope you all had a great weekend. Yes, Steve was first today. Yes, Steve, you were first today. Rubies, thank you very much. Yes, hit the like button and ring the bell as well. Jim, Iowa, how are you? Nancy, welcome. DDaz, not first. That is cool. Christy, Florida. Janna, how are you doing? Janna, how is your health? RB, mom is there. Closet picker, 7th. You actually counted closet. Roller girl is there. Wayne, Will Arizona Vax, AstraZeneca Vax. You know what? I had always been little skeptical of AstraZeneca, remember? And there were folks who said that I don't like it, maybe because it is not a US one. But anyways, you're seeing that there are some things with it. Has been welcome. 11th. Catherine actually counted as well. Rima, welcome. How come only YouTubers get to be first? Cat, Bean, and Lotus here. Absolutely welcome. And Luffy is sleeping. This is actually his sleep time. He usually wakes up a little later. Maybe he would wake up and come in. How is Lotus? Is she sleeping or just sitting? Pfizer Oxas one, I have to still look at how Pfizer's latest data is. So give me a day or so, and I'm going to compare these vaccines. Fun for JC, welcome. Oleg, hello, doctor, glad to hear you. Welcome, thank you. I was skipped, sorry. Luffy, yes, Luffy's out there. Rubies are red says, Dr. Bean, you and I both have been skeptical of AstraZeneca vaccine due to its dramatic data. Yes. And yeah, I always felt unsettled with its data. Siddhartha, how are you? And Siddhartha, I'm so sorry I had to reach out to you today. And since the morning, I was just working with so many of the business matters. Please don't mind. Oh, I wanted to tell you this all. So I had a 8:30 this morning. That discussion with Dr. Corey and Tess, Laurie, and 3 more doctors who are prescribing ivermectin in various other countries and are on the leading side of it. These 5 folks will be with me on Thursday morning. It will be a Zoom call, and they would separately record it and then edit it and then publish it on their site. Wednesday, that is day after tomorrow, we have a 8:30 rehearsal, and then Thursday we'll have the discussion. There was about 6 people's team this morning. I really loved it. Dr. Corey was there as well. And what I really loved was that they were very appreciative of the cool beans and the work that we have done. They were so happy about it. They said that your impact, and by you, it's not me. They were talking about cool beans too, because what they were saying was this is, and I say it very often, they were saying that this is the group, cool beans, who are very informed and technically very savvy. So, and they said these cool beans support for FLCCC is very good. So thank you very much. Thank you for spending time with me. Thank you for learning so much. Thank you for then sharing it. Thank you for then supporting FLCCC. They were very, very happy about it. The way they articulated this was, they said, you are, and by you, they meant us, you are a very warm supporter of FLCCC. So I'm glad about that. I'm happy that we are all in their ballpark. Okay, so what's happening? Machiavelli says, just saying what I read. Thank you, Barbara. Paul Elkin says that AstraZeneca has been deceptive in their data and press releases. They withheld critical data from FDA too about the MSNT. Yeah, so I did not feel that great about them. Hello, Nina. So Machiavelli says, Astra said their study showed no correlation to blood. This is this is what makes me upset with all of the vaccines, including Astra, that whenever some really severe side effect occurs, they simply say there is no correlation, or it happens the same way that it happens in the other population as well. I think that is where these companies are not doing right. Nancy says Novavax may be ready to get emergency authorization in US in May. So February, March, April, May. So we are in March, April, May, 2.5 months. I think we'll be probably mostly done by that time. So Simple Meerkat says they're pulling Astra. Simples from where? All the world market, or I know that in the Europe they're stopping. John Snyder, we could have donated all that AZ we have stockpiled. Too late now. Susan says I was skipped too. Sorry about that. Sinovax. So I did one talk about Sinopharm, I believe. That was Sinovax. I think I've talked about Sinovac, have not talked about CanSino yet. LEG says unable to connect. Dr. Bean, I finished my antibiotics tonight and took my high dose ivermectin. I think infection better. Everyone I have worked with the correct dose, I don't mean even high dose of ivermectin, with the correct dose, they actually work very well. I wanted to read you this note as well. This is from Dr. Syed Heather. So Dr. Syed Heather is on flccc.net as well. And let me just very quickly read his comment to you. I think this is very, very useful. 1 second, I'm just opening up his email here. So slightly longer, but I think it is really important. From Janna's message, I remembered it. So Dr. Syed Heather says, Dear Dr. Mubin, Steve Kirsch reached out to me about a month ago. So Steve is also a connection with me on Twitter, great guy, a month ago, and shared his data on fluvoxamine, which prompted me to add it to my protocol. So Steve shared that with me as well. For acute COVID-19, before that, I was using ivermectin with colchicine. So Dr. Syed Heather is saying that I used to use ivermectin with colchicine. Then Steve Kirsch shared fluvoxamine data. I wanted to share the experience I've had so far, which has confirmed the data by Lens and others. So check this out. This is beautiful. So far, no one was hospitalized after adding fluvoxamine to the protocol. So that is his punchline. No one in his outpatient now is hospitalized. No one is hospitalized once he has added fluvoxamine. He did say in the next follow-up email that he did add low therapy steroids after speaking with me. So his protocol has now become ivermectin, colchicine, fluvoxamine, and after the viral phase, then 7 days or for 6 days of low therapy delta cotril. So that is what he has picked up from here as well. So check this out. This is a change from before. When using ivermectin and colchicine, I saw at least 2 patients hospitalized in the month before starting fluvoxamine out of a small cohort of about 20 acute cases. So 10% hospitalizations. Another patient would normally have been hospitalized because their oxygen saturation dropped below 80. But they would then come back to home. Also, no one has even gotten worse after starting ivermectin plus fluvoxamine, Again, a definite change from ivermectin alone or ivermectin plus colchicine when at least 20% worsened after starting, especially those who came after 5 days of illness. So he sees no further hospitalization. And you know what I think is going on? Fluvoxamine can cross the blood-brain barrier and it actually goes and works in the brain. Ivermectin does not go in the brain. So these two together actually work in both places. Um, Then he says, so far I have not seen anyone who started in the first week of illness stay sick longer than 2 weeks. This is also a change from ivermectin plus colchicine. At least 10% or more of patients starting ivermectin plus colchicine between day 5 and 7 are still sick after day 14. So his patient's sickness number of days has reduced as well. In the US, colchicine use has also been limited due to side effects. And I think that is going to be the issue with fluvoxamine as well. So I asked him, I said, can I share this with the cool beans? And he said, yeah, definitely. And then he followed up with one more and he said, I did also incorporate your low dose dexamethasone taper starting on day 7 for all acute COVID patients. So that is also a factor in his observation. So So this is also very important because I actually don't agree with FLCCC's 5 days only ivermectin. So check out his 5 days experience. I also noticed that when using the FLCCC protocol of 2 to 5 days of ivermectin and stopping if they felt better, at least 1/3 or more of patients would then feel worse the next day after stopping. And eventually, I started recommending 5 days ivermectin for everyone, and then switched to recommended, then continue until they feel better. This is my protocol. So I have from the very first day, I had always used ivermectin until they become better, because ivermectin is really not a antibiotic to be used for 5 days like an antibiotic. So I actually feel that ivermectin should be used in acute patients, in patients who are actively ill with COVID, continue till the patient has recovered. So once again, not an advice for anyone, not a prescription for anyone, but a very important observation from one of the, so anecdote, one doctor and his patients, but a great outcome here. No hospitalizations. So Janna, this is a very important thing to take full dose ivermectin, I believe, and then see the results. Jenna says, did you know inflammation causes depression? Yes. Sapel Steve is saying the right thing. Hit the like button and also smash the bell button. Wayne says, Paul, I heard a lot about fluvoxamine. Is that a steroid? No, Wayne. So what happens is in our brain, there are many neurotransmitters, meaning there are many chemical substances that are released from the ends of our neurons. And then those chemical substances act on the beginning of the other neurons. And that is how electrical stimulus is, or impulse travels from one neuron to next. Within the neuron, when it is traveling, it is electrical. Then it becomes chemical, that is chemical substance, and then it becomes electrical again. Serotonin is one of the chemical substances that can be released by one neuron and to the next one. And serotonin has a lots of functionality with the behavior or mood, because it is released in the brain's areas which are related to mood. What we have seen, or what researchers have seen, is that some serotonin abnormality is observed with the COVID. And so that causes that fatigue and myalgias and depression and anxiety and the feeling. So there is an actual physical part of being tired because the virus and inflammation has done something. And then there is a psychological aspect as well. So somehow fluvoxamine, it's not only just a psychological, it has two effects. Number one, it balances out the mood. So it reduces serotonin reuptake, which increases the serotonin levels in the brain, that improves our mood. Second is, it is a sigma 1 agonist as well, which in turn reduces the inflammation. So it reduces inflammation in the brain, just like um, ivermectin does that for the rest of the body. Plus, it improves our general mental well-being, which I would suspect that once we are feeling better, we'll do things better, we'll go out for a walk, we will do exercise, meaning it would generally move us towards a better outcome. So that is how fluvoxamine is. And when I have done a discussion in the past about it. Yes. Maybe with Luffy crashed out, Kyrie can take the stage. So I just heard about Luffy. Let's see if he comes down now. It's time for him to get up. Um, Correct, Paul, you're right. Do you know that I deliberately skip over medical cannabis questions? Jim, I really love it. So there was a doctor in Germany, I believe. I tweeted about him over this weekend as well. He made his own vaccine. So it was so beautiful. They talked with him, although he is now under investigation, and I think it got arrested as well, which I think is so sad that doctors who are trying to be innovative, who are trying to figure out things, they are getting in trouble. So what happened was, he said that, hey, in our lab, we have antigens to test for COVID, right? So for COVID tests, they have antigens to test the test to see if the test is correct. So he said those antigens are COVID antigens, although they are there to build the tests and to test the tests. But what he did was, he took those antigens and he used them as vaccine for himself and I believe his family. And so he was, I believe, he's charged that number one, he made something which is unauthorized, and number two, he used something that was unauthorized, which I thought was really sad. That there is someone who is being creative and they are punishing him. Doug says Dr. Bean is a pothead. No, but because I teach medical lectures that are for CME, CEs, and I cannot talk about these topics. But no, I'm not a pothead. No, Janna, that is totally fine. It's just that some of my talks, there are certain regulations, and we are already under audit as well. So what I'll do is this: I'll read up how much I can discuss, and then I would come back and discuss. Yes, he was treating. I think he gave it to his family, rubies. I got a kick out of it. That was genius on his part. He noticed that he has the COVID antigens that they use to test the test. So he said, if this is a COVID antigen, then this should act like a vaccine as well. And he used it as a vaccine. I was cracking up. Thank you, Franz. And yes, Stephen, thank you very much for the super chat. Is there a question with that? So Stephen Westman says, friend who is in the NVAX USA trial, he either got the placebo or he is a Superman because he had no reaction. Crossover date uncertain. Is it irresponsible of his family to stick with the trial? So actually, I forgot to mention this. They said not much side effects, and the side effects were very balanced. They use the word balanced with placebo. So I did not, they haven't given the data for me to actually see what are the side effects, but I'm seeing so many of the vaccines actually don't have much side effects. So if somebody really wants to be sure, then the best thing is to donate blood or get the IgM and IgG. Again, not for the US here. Please do what they're asking. I don't want you to get in trouble, or just like that doctor is in trouble now. But generally, with my patients who I can treat outside of the US, I usually ask them to just go get their antibody test. Yes, Caroline, that is a great idea. That is genius. That is creative. And now he's stuck. So, Andrea, this is a very good question. I have had severe idiopathic thrombocytopenic purpura from COVID. Would that make me more prone to ITP from vaccines? So, if COVID caused it, that means that the COVID related immune response can cause that. So, my request will be to talk with your doctor first. Number one, why do you need a vaccine? And number two, if you are going to have a vaccine, then please talk with them and make sure that if you're going to take it with their supervision. Oh man, this is so baby blue buttons. I am so sorry. This was one of the top things in my mind. And what happened was this geared doctor's uh, thing that became, it just blew up. And I talked about it, and then people started becoming upset with me. And I had been just since then dealing with that. On one end, I want to clarify further for why he is wrong. On the other end, this is just, it seems so silly that somebody is saying 2 plus 2 is 6. And now we have to go and say, no, 2 plus 2 is not 6, it is 4. And when we are trying to correct that as well, then people are just beating us up as well. So I have been just heads down responding. The problem is that there are some folks who are so scared on the YouTube that they say, we just heard about this, we just had our first shot, now we think that we're going to be in trouble because Geert said that people who have taken vaccines, now they're going to be in trouble and this is going to be a huge issue. So they had been messaging and asking, and I just had to work with some of them to say, this is exactly the mechanism, this is where he is wrong, this is what is a mechanism he's saying which does not even exist in immunology. So I was distracted. At one point, I thought that I would invite some of the cool beans who are worried on a Zoom call, so they don't have to type here. They can just interact directly with voice, and we can then go over the paper. We can discuss it on with a screen share, and people can just ask questions, and interact. But then it just seems too much time gone by too. So this is what happened. But this is a very important thing that I need to talk about. So it is on my radar. So how are things? Paul says, studies have shown a T helper 1 dominant response is associated with asymptomatic and mild cases. Do you know which vaccine produces a T helper 1 dominant response versus Th2? Guess which one actually said it again and again, and we discussed it. Guess which one, Paul? I think you may have heard about that one as well, Johnson and Johnson. Johnson and Johnson kept coming back and saying, our vaccine produces predominantly T helper 1 response. They wanted to capitalize on this concept. So Johnson and Johnson does that. Peter, you are very welcome. Oh man, this was this was just so much this weekend, the whole weekend. Folks sending me messages, emails, comments, hate comments, just simply confused. Then there was a lot, and I had to go and see which one are just simply rude and are not adding any value or not taking any value, so I would just remove them. And then which one actually are confused now, and now they are legitimately trying to understand what is going to happen. Are we all going to die in next 2-3 months who have gotten the vaccine, and or we going to mutate, or what is going to happen? And so I had to answer them, and there are a number of things. And they were, I believe, for that video, there were people who were very angry that somehow when they search for geared, that video of, although my video's title is what was that, uh, open forum March 12, but it shows up on geared, maybe because in the description I have given his links and talked about his messages. And so then people are here to go watch his video, and instead they end up on my video where I have criticized or shown some of the flaws, and they become very angry. And so then they report it, and it was a mess. Quite a lot of and I would not tell my wife that what is going on, so she's now, hey, Sunday is off, and I'm not telling her that I am just dealing with this. Leslie says, how could anyone hate you? You're a living doll and sweetest and smartest doctor. Thank you. Oh man, there was so much of hate. India, thank you. Thank you very much. People were very angry. Thank you. Thank you. Doug says, Paul, I watched the channel as well. I've already had the Rona. Wow. So Doug, you're doing good, right? Okay, so Jim, I actually felt that as well. I know. So Jim says, I now believe we need to have a second show discussing the controversy better. I watched his video because someone sent it to me, so I'd like to change my vote from a no to yes. If you like, we can actually hang up this chat and start one more. Or if you like, I can start a Zoom. And if there are some folks who are actually honestly curious and worried and want to see what is going on and see some of the issues with the discussion, I can actually have that discussion. And the reason that I wanted to do it with Zoom, it is actually easy just to put a comment anonymously and just say, you suck, or you are the worst human being ever, or blah, and then just go. And that has not added any value, or it's of no use. So I can do either another discussion right now, or we can do a Zoom right now. I'm open to this. Doug White says, don't leave us. No. So Baby Blue Button says, I am honestly curious and worried. So do you want to do a Zoom? So Amy says, not again. You have spent, Amy, I am seeing that there are some folks. So here is a deal. Margaret says, no, thank you. Here's a deal. If I do another YouTube video, the outcome is this. Folks who don't like a rebuttal, because if you Google and if you look at Twitter, you would not see anyone actually providing a response. Everybody is saying, there are so many people who are saying, hey, he's incorrect, these are baseless discussions, this, what he's saying is not possible. Even then, they are not connecting it to the actual concepts. And the result of that is that people now are just like they did to me. Many of them commented and said, you are a generalist, he is a specialist. He has been there for 40 years, you've been there, nothing. Somebody said, you're from Pakistan, he's from... Anyway, so they looked at those things and then said, we don't trust you, we trust him more. So eventually it becomes a matter of not seeing the knowledge, but to just see who can we trust more from credentials or age or experience. So I am fine um, having that discussion if it is useful. On the YouTube, when I did it, even when I had not used it, that just came up. And I had done the preparation to discuss it because in the Twitter, some folks had asked me about it. Even then, I got reported and we got demonetized. And YouTube is now, once again, we have appealed for some things and they are saying, okay, we are reviewing. So that seems an unnecessary churn on my end to um, to do it that way. But tell me, the cool beans, you tell me, how would you like it? So Arcade VM says, why can't we implore vaccine companies to team with ivermectin? Dr. Tess's recent interview on Trial Site News is so compelling. Her research is so good. Yes, so I have been saying it from ever that ivermectin should be used. So Luffy's here. Ivermectin should be used while we're figuring out vaccines. And I have always said vaccine is not something that should be forced. Some people are not comfortable with it because it is new. Some people are not comfortable with it because it causes allergic reactions. For example, you just saw a question with ITP. Some people have autoimmune diseases. Some people have allergies. Some people are genuinely scared that, hey, may it cause autism or some other issues. So I don't think that folks who are pushing back are actually just being bad behaved. I think they're just trying to protect themselves as well, and whatever makes sense to them, they're trying to do that. And so, if it is useful to have that discussion, I can, because there are so many incorrect um, uh, concepts in there. But at the same time, doing it on YouTube would only get my site, my YouTube channel, hammered, resulting in lots of negative outcome. Jody says, I think we should talk about vaccines. Okay. So please reach out to me maybe on Twitter or direct message. And if somebody is really curious, we can just do a separate chat on Zoom and discuss it. Fish says, did Geert respond? No. Actually, someone sent that here is what he thinks. And I responded and I said, here is a concept that he said exists. Please ask him to give me any one proof of that. And that person was arguing with me before, but once I said it, they never, for now 2 days, they didn't even come back. That is correct. So Leslie says, I'm scared of the escape variant if he's correct. That is the thing. I'm going to start this one once again. And so think about it for a second. Let's follow Geert's thinking. Here is how he started thinking about it from his paper. I was not in his head. He said, don't give vaccine. So that is his first basic position. He's also not for social distancing. He's also pro-infection generally. And I know that then cool beans come back and they say, well, you're saying wrong about him. His position is this, his position is that. And I can't sit here and discuss the positions. I am telling you what I heard. I may have misheard. I may have misinterpreted. And that is the thing. Whoever is going to hear, they're going to have their own story. So this is the story that came in my head. And here is where I am. And yes, many of the folks then left a message under the YouTube video saying that, yeah, so your head is not right. You do not understand things. You're too simpleton to understand the superior knowledge is providing. But think about it for a second. What he said was, don't give vaccines, because if you are going to give a vaccine, let's say I get the vaccine, then the virus comes into me and my vaccine captures it from his hands, then the virus would evolve into another kind of a virus that can get its hands freed from the vaccine, just like previous variations, mutations. What so one so let's continue going with his thinking. So then the next part is, if this happens, our body is not going to be sitting idly by. Our body is just going to say, fine, this is a new virus for me, and it's going to handle it. Just like with SARS-CoV-2, we handled it as well. Yes, we have huge damage, but we handled it. It's not, majority of the people didn't even care. Their immune systems didn't even bother and just took care of it. So then if you think about it, how did he then responded to this question, that yeah, our immune system would handle it. So what if variation occurred? We have hundreds and thousands of variations already occurring in this virus, and this virus's variation rate is low because it has a proofreader. So he said, well, the next best way is to say that our natural immune system will not be able to respond properly, because vaccine would have created a super immune system which would outcompete the natural one. And that is another. So previously there is another flaw. So the previous flaw was, and again, I know that people are going to once again get this video flagged as well, and then YouTube is going to once again make a mess with me. But the thing is this: the previous flaw is that if you capture the virus from hands, from spike protein, it cannot enter the cells easily anymore because you have captured it. So it cannot just go in and say, you know what, I'm just going to get into the cell, use the machinery, and form a new virus all of a sudden. So the majority of the issue it's going to have is to be able to get into the cells, replicate, and then come out and be so different that the vaccine that is present, the antibodies, cannot catch the new one. There is no variant yet that has done that, number one. Number two, second thing that he is assuming now is that immune system would not be bothered by the changed virus. Somehow immune system would say, I cannot handle this changed virus. So now the question is, why would immune system say I cannot handle it? So imagine now Geert is thinking, why would it say that? And let's form a couple of reasons. One reason is the out competition. In our body, there is no concept of out competition. When the vaccine triggers a B cell to make antibodies, it would make antibodies just like in natural infections antibodies. So if, let's say, I was vaccinated, I got the virus comes in, my natural response would probably start in 2 weeks if it is the virus is appearing for the first time, the remaining part. Imagine I'm the virus. So I have these hands are trained. My immune system is trained against my hands because of vaccine. But my immune system is not trained against the rest of my body. So when the virus arrives, my immune system is still going to get prepared and in 2 weeks attack the rest of the virus. So there is no possibility of out competition. Now, let's say even after that, there is a new variant that comes in. Imagine that variant is so different that vaccine related or natural immunity related antibodies cannot catch it. That means virus has so drastically changed itself that the spike protein is totally something else. And we've talked about it for a long time. Then our body is just going to take it as another virus and then take another 2 weeks to handle it. So would it be now more contagious or more lethal? No, it would not be more lethal. Even if with the current variants who are becoming more contagious, they should not be more lethal. Even with the UK saying that, hey, we think it is 30% more lethal, there were so many, it may be, it possibly is, it's that is, the window of time is 28 days, while we know the original type actually can go up to 6 to 8 weeks before somebody dies. So there were so many flaws in that. Then let's say this is not sufficient in Gates' head, and he says, you know what, this is not enough, that immune system would be um, not able to work with it, outcompeted. Then I said, why not we say that immune system is just depleted? Now, there is no concept of immune system depletion because of some infection, unless infection is overwhelming and it causes sepsis, and people die of sepsis. Many of the wild type infection people who are dying in hospital are dying of sepsis. Or a person who has immune system disease, for example, and I have been saying it, from point A of getting the infection to point B of getting reinfection, if a person's bone marrow has become suppressed, or we have started giving them anti-cancer drugs, or we have somehow caused something to them that has changed their immune system's behavior, then once again, they can have an issue. Otherwise, no, their immune system is still there. It's not depleted. It's just going to take the new virus and say, I'm going to fight with this one. And that's what our immune system does the whole life. Every second and every minute, we are ingesting and taking viruses. So that was kind of not the best. Then a bigger attack in his mechanism on the response to the virus was that infection or arrival of the virus again will deplete natural killer cells. That I'm so sorry, I am just so openly talking about it. I know what happened on 12th, and I didn't learn a lesson. Natural killer cells cannot be depleted because of an infection that has produced antibodies. Now, let's give some flexibility to Geert and say, okay, let's try to do this for him. Let's make this mechanism happen. One way to make that mechanism happen is that we ask the virus to specifically infect the NK cells and destroy them. This virus doesn't do that. NK cells are not its target. We adults do have lesser NK cells because of our stresses, which produces steroids and which produces epinephrines and those things, which are suppressors for NK cells. Secondly, our NK cells are not as well trained as children's NK cell, because children keep getting the respiratory infections, and so their NK cells are kind of used to doing these things. It is a theory only. In reality, an NK cell that was infected with, let's say, or that had fought with rhinovirus is not known to have reacted against coronavirus. So it is a theory, and I talked about it 8-9 months ago. But let's say that is a theory. So in adults, we usually don't get that much of the respiratory infection, so our NK cells are not that well trained. So NK cell would stay there. They will not be depleted. Virus will not infect them. Similarly, there is one more way to destroy NK cells, is to convert virus into something like an HIV virus, where just like HIV actually directly just destroys immune cells. We ask the virus that you are going to do nothing but just destroy the immune cells. That means really we are saying that coronavirus is not coronavirus anymore. It is an HIV virus. That again, it cannot do. It has not been able to do those kind of things for decades. It lives in us. So to think that somehow coronavirus would transform into an HIV virus will be a very long jump. Then another possibility, I'm just trying to make up mechanisms to support him. Another possibility will be that the antibodies that are made for coronavirus or by vaccines somehow get targeted back to our own immune system and just start destroying it. So we see that kind of dysregulation in a smaller number of people who then eventually die. But it is not the possibility in everyone. That is why a majority of the patients don't even bother about it. The virus cannot come back and say, you know what, I have changed enough that I want to have a cytokine storm in everyone. The cytokine storm is not virus dependent. The cytokine storm is cytokine storm dependent. It's immune system's design dependent. So if I don't have a coronavirus cytokine storm, then I'm not going to have a storm. And if somebody had a storm, if you give him another coronavirus, they can have one more storm. So possibility of NK cell depletion is not possible. Possibility of just immune cell just totally depleted is not possible. Possibility of virus reinfecting us in a different way, and then our immune system somehow just not responding to it, is not possible. Possibility of creating variations was always there. There are next strain cool beans, you know it. We have been talking about next strain from the very early time, and they look at these newer strains and all the time. And so what? Newer strains come in, our body is capable of recognizing an antigen and responding to it. Our body for the rest of our lives would continue to pick up new antigens and respond to them. That's what it does. Do you know that 90%, 99% of our infections are managed by our body? Only 1% take antibiotics. So there are so many gaps and incorrect mechanisms that don't even exist, that trying to explain that, to say 2 + 2 is 6 and let me try to figure out how, is a difficult thing. And it was funny. I kind of mentioned in that context with someone, and he said, yeah, because you are stupid and you don't know what he's talking about. So you can't explain what he has been thinking about. And I said, fine. So this is my request will be to not worry. I mean, I was really hurt when I saw someone who said, I just took the vaccine and now it looks like I made a very bad decision and I should have said no to it and I am now going to die. And I responded and I said, no, that's not the case. And they were so happy and grateful that thank you for giving me that support. This is what I don't like. I have never done it. I've never done this fear mongering, and I don't like when somebody does it. Okay, so some call Dr. Bean the S word. All words. Over this weekend, I was called all kind of. Even the funniest thing for me was people would come and comment and say, I don't want to be unkind to you. And then they would start writing things. And I would chuckle and say, well, don't have to say I don't want to be unkind. Just do what you're doing. At the same time, I do like that people are able to comment and they can leave their messages. Some folks are actually genuinely curious about things. And I don't want to suppress everything to turn off comments. But there were some comments that were just really insulting. So Janna says, I'm going to rest my eyes. Sleep is best medicine. Dr. Bean, you're such a blessing. Love all to the beans. Thank you, Janna. Hopefully you would feel better. Please, full dose of medicines and you would really feel a magical response. Margaret says, exactly, Bean, the people causing noise have no defense. Yeah. So, Debbie, I don't know exactly what you are again implying here. So there is a long list of immune deficiencies acquired from infections. Yes. And yes, stressors, including vaccines. Sure. Dr. B is not a qualified immunologist and it doesn't take being given immune. So, and it was not very clear. The problem is it's not about qualified immunology. It is about the mechanisms. So somebody, just like you made this comment, somebody made a comment with some more rude language in there as well. And I responded back and I said, you insulting me would not change the immunology and bring new concepts in it. Immunology is going to stay immunology. That book over there for immunology would have what is in it, and these are the facts. So you can't say that somehow the immune system will become depleted, NK cells will be destroyed. That's just not going to happen with coronavirus. So that doesn't mean if I have a degree here and then I said it's going to be your NKs are going to be destroyed, then somehow my degree is going to change medical concepts. That's not going to happen. Okay, so how are things? William says, Dr. Bean, sometimes would you do another deep dive into the statistics and safety of these vaccines? Others, as well as myself, are concerned to know if they truly are safe. Try. Thank you. Absolutely. So there are, for example, this AstraZeneca is not the best at this time. There are other vaccines also that are not performing that well. So we should do a comparison and see what vaccine is doing. I read a note in one of the news outlets. So again, take it with a grain of salt, a news outlet, where they had compared some of these vaccines like Moderna and Pfizer to other vaccines in the world that are being used and these side effects with those. Javier says, hi, doctor, what books do you recommend for learning basic medical knowledge? So, of course, there are a bunch of medicines, but I think in the context of today's discussion, probably you would like more about immunology. Lange immunology to get started is great. And to folks like Deborah, even folks who do PhD in immunology, they study my immunology courses. I have never tried to brag here, but majority of immunologists, their basic courses are actually by me. So this is a good question. MS Hana teacher 1. I'm Shana teacher. I'm Shana teacher. So my apologies that I haven't looked at it. I would actually do this discussion next. P. Leach says only 2 uses of fetal tissue to help create the wax, not in the design, just like in the case of, I believe, Moderna's design, and to test its efficacy. Yeah. So again, there are folks who object on that as well. And I am again not going to say that somebody who's objecting on it is right or wrong. It's their decision, it's their belief. The good news is there are vaccines that are outside of this realm as well, just like Novavax, which are a good option. Teardrop says, that was a great monologue. You can't fix stupid. It's just, what hurts me is that when people become scared because somebody is fear-mongering. Thank you, Emily. Thank you. Texas says the new book, Believed, speaks of these demons of unexplained science phenomena. Very interesting from Descartes onward on this very subject. That's very interesting. I would love to read that. Yeah. So look here, Don says, I have ethical issues with use of fetal tissue derived from aborted babies. So yes, so there is a number of folks who feel, so I found out while talking about these that there are folks who says absolutely no. If fetal tissue is used in any capacity for a vaccine, which nowadays they're used for many drugs as well, they say no, don't want it. Then there are some folks who say, well, if the vaccine is not manufactured in the fetal tissue clone cells, but maybe designed in them or tested in them, that's okay. And that's another level of flexibility. And then there are folks who say, fine, I'm okay either way. That's another level of flexibility. And I think The good news is that instead of trying to argue with everyone to say, no, you should like it or you should not like it, there are choices. And so one can say, I don't want a vaccine at all. That's a choice. That's their call. Or they can say, I want a vaccine, but it should not be in a fetal tissue. And so let's say Novavax is for them. Or they can say, I want a vaccine, but it should only be designed in the fetal tissue, not built in it. Moderna is for them. Or someone who says, I'm fine with the fetal tissue, and then there are other vaccines. Meredith says, thank you, Dr. Sayer, for teaching us with integrity with your work. You're saving lives. Thank you very much. France says, hit likes. Yes, France, thank you very much. Yes, otherwise we'll all start doing a hula dance here. Look at this. Odrasir says, I have ethical issues with money. Right? Doug says, you didn't miss anything. Is that... Lori says that, thank you, Dr. Bean, love your illustrations and cartoons. I'm a visual learner and your work is wonderful. Thank you very much. When I started these discussions, I wanted to, for my own sake as well, I actually visualized if somebody had a children's book and just kept going over it and told us what it is, it may have made it more interesting and easier to digest. So I actually thought if somebody could do that for myself, and then I did it for myself and for all of the cool beans as well. Annie says, question, is there a reason to have concern of ivermectin crossing blood-brain barrier and causing brain damage in someone with seizures caused by long COVID without a clear understanding of the cause of the seizure? So seizures, blood-brain barrier compromise can be a reason for seizures. But usually if blood-brain barrier is compromised, then there are much more issues than just seizures. So this is a difficult one, and if ivermectin is needed, should be taken with a doctor's advice and supervision. Truth Seeker says, I'm late. Doug, what were you saying to Truth Seeker? You didn't miss anything. Okay, so Country Salvage says ivermectin is also used for Lyme disease. That's very, very interesting. Jim says, can the kidneys in the green monkeys have the AIDS virus? So if just generally you want to talk about it, they could. But if you want to talk about the vero cells that are used to develop vaccines or drugs, these vero cells are very tightly controlled for what genes they are expressing and what extra genes are present in them. So they're very, very tightly controlled. For example, these vero cells may have adenovirus replication gene in it, and that is inserted from outside. And that is actually a very difficult thing to do. This is why if I sway away to the M5 cells, which were from a fetal tissue, or the 293. Remember that 293 was the number of experiments where they kept trying to transfect the cell and change it to the point that it would just die every time they tried to transfect it, to the 293rd one survived. So usually these cells that may have viruses or that may have other issues, they don't even survive. They can't live. So these have to be good, clean cells, then properly managed. France says, 162 likes, smash that lazy beans. Yes, I am with France on that. Caroline says, question, writing a book was something you discussed quite some times ago. Was it with Siddhartha? Yes. So we talked about writing a book. I started a GoFundMe as well. So far, as you can tell, I spend majority of my day discussing a new topic and studying for it. The problem with writing a book is, as much as I do designing here for you, for that book, the whole composition, writing, grammar checking, designing, as you can tell, I may not have the best grammar. That I could not put the team together because we didn't have enough resources created to do that. Siddhartha did attempt to help, and I appreciate it, but we couldn't put the whole team together. it takes resources. John Snyder says he should put out a book, price for biology textbooks. Um, So Anna, this is actually a very, very interesting thing. And I wanted to discuss that today. So maybe tomorrow, that what's going on with Israel. Um, Sigrid says, Facebook not notifying. I finally searched hello. Hello, back to you. So it looks like we have 3 tiers of censorship that is happening. On Twitter, after the Periscope is done, Twitter would just simply say this broadcast is not available. On Facebook, and I was speaking with FLCCC about this in the morning as well. On Facebook, it seems like they let my video be there, but sharing or propagating it, they block that. On YouTube, in the beginning, we used to have the videos taken down. Now it seems like instead of video getting taken down, they just demonetize it. They say, we're not going to let you earn from this video. And that way, that is how they are censoring, but they're not taking it down anymore. Barbara says, Dr. Bean really needs to write one. I'm willing to help with basic editing. Awesome. I think we have to. So the basic need at this time is for someone to who can do project management. So far, there are folks who can help with various roles, but someone who can head that team and say, okay, I'm going to look at who can do what and start disseminating tasks and then shepherding tasks or then asking for who has done what, that falls on me. And as you can tell, my time has become so restricted that even for my own home things, I am behind. So we need a project manager first who can then start putting things underneath. Oh, wow. Andrea says, I'm a project manager and live nearby in Santa Cruz. I love Santa Cruz, though. Um, it is a beautiful place. And Andrea, do you have time for project management as well? If so, we should talk. So Plant Kingdom says Novavax has no fetal cells used at all. Not at all as far as the knowledge that they have opened up. So what they do is they call it recombinant spike protein. First, they use the RNA in a to create a virus. That virus has this RNA in it, and they use a bacteria to make those viruses. Then they take that virus and put that in a moth cell, the butterfly cell. And inside the butterfly cells, then those viruses grow and they grow the vaccine RNAs, and that RNA then allows the cell to make the spikes. Then they filter out the spikes and then they put them in a medium where spikes just kind of with the adjuvant, they bind together. That is how they do it. So in this whole process, there is no concept of any kind of fetal tissue or human tissue. It is an insect tissue and bacteria and a virus. Doug says, what is happening? Are we done? Yes, we are done. And yes, we need to look at Brazil as well. Skyfrog says, oh no, we'll turn into moths. Butterflies are beautiful, but no, we will not. Emily is a professor. Wow, very good. So, Plant, this was so let me tell you my basic vision of the impact I could create in this world was, I think that technology has reached a point where medical concepts can be taught from 5th grade or 8th grade and onwards. And so young students should be able to, just like they watch cartoons, They should be able to see medical concept in this simple and easy ways, understand them, and then be able to use them. For example, I gave this example before as well. Uh, Many patients of Lyme disease sometimes are not aware that maybe there is a solution out there, and then their whole life is spent in a not in not full energy, and that is a distressing situation. But let's say if we have educated children right from the beginning that, hey, this thing may have a solution. If this happens, try this. This is how to stay clean. Here is how viruses work. Here are how vaccines work. I think it is time to move medical knowledge to the next level. That would put pressures actually on nurses to then they would rise up to a doctor's level, just like NPs or PAs do. Doctors will have to then figure out how do we go one level up. And I think the whole humanity would actually evolve even more on better health, longer life, and better high quality life, whatever is the age. So that was my mission with which we started Dr. Bean, with which I have been doing this as well. Hopefully, as the resources we keep creating, we would do those things. So you hit it on the head. This is what my main mission has been. Rajesh, welcome. So Rajesh says good morning, good afternoon, good evening. Rajesh, welcome. So Doug, you're correct. NPs are not MDs or PAs. That is correct. Nurse practitioners are nurse practitioners, but there is an intent for them to be able to manage and prescribe. So why not add more knowledge? And similarly, why not add more knowledge to youngsters as well? And kind of just push the whole thing up. Yeah, so Sean says Khan Academy. Imagine Khan Academy for medicine. John Riaz says, since the variants sadly seem to be winning, shouldn't we promote tracking ivermectin in the world? Yes. Yes, we have been saying it for a very long time. Luckily, now we have FLCCC, which is trying as well. So there is a bunch of momentum. But yes, ivermectin should be a very important thing. Jaladoni, I rely on Dr. Bean for most of my classes to verify correctness. Thank you very much. Rajesh says that's a great vision. Thank you, Rajesh. Working for it. Roman says, I agree 100%. And it would be amazing if American doctors would acknowledge the place herbal medicine has in medicine in general. It would really work well for many years in other parts of the world. Absolutely. And we recently, on Dr. Bean's side, we recently have started working with an allopathic doctor from Ireland. And she is actually great with the integrative medicine and herbal medicine. She just loves it. So she started doing it out of her own love. And she has some great insights about the herbal medicines and integrative medicines and other aspects of medicine. So we have actually requested her to build some content for us because I believe in it, that it's not just the allopathic medicine, but there are other factors that are needed. So you're very correct. So Doug says, what is happening in Brazil? So let's see. I actually have some of these things open here. So just in general, as we do it, 381 million doses for vaccines. A lot of vaccines have been given. Israel is still at the top, then Seychelles, then UAE, other countries, Maldives, UK, US, Chile, and others. In the US, here are various states and so on. So that is that. Israel, see, I had already had them here. Israel's numbers at this time, so when they were here, I was concerned. So maybe there are numbers that need to be reported after this weekend. But now the numbers look much more in line with the vaccinations results. They should be going down. And I actually have another detailed data plot opened here, where we see that actually youngsters are now relatively more infected than older age. And if you actually go to their Israel data breakdown, you would see for various ages and the vaccination levels, early vaccination, late vaccination, and cases from them, and hospitalizations and severe cases. So I thought I would discuss this as a general separate topic instead of just mixing it in here. But this data is present here. Brazil scared me. Look at this. Look at this. So the thing is, I just looked at the numbers. I did not see yet what is causing this. Look at their active cases going up. Look at the deaths. So Brazil there is an issue there. What is exactly the problem? I have to read up. So why not, instead of doing the vaccine comparison, tomorrow we talk about Brazil. I'll do what research I can. I was actually more worried about South Africa, because South African variant keeps coming back as something out of control. So this may be either, once again, social distancing, lockdowns, masks, ivermectin, or something else. But South Africa seems to have gone down a lot in their active cases. Does anyone know what is going on there? And there, of course, the number of deaths are following that. US, total cases, daily new cases are going downwards. Active cases are still not that drastically down, and the number of deaths are going downwards as well. UK, if you see here, this is, so I would say once again that, as Cool Beans have been saying, this is probably the result of the stringent, strict lockdown that UK has almost brought this to this hugely reduced level. The number of deaths are, I am actually, of course, every death is an issue and a sad thing, but compared to where this was in January, this is much better. Now the question is, if they are in lockdown, then how are they going to come out of it? So let's talk about Brazil tomorrow. Rima says they've been using ivermectin, although someone said that they have an election coming up, so they may not be reporting. That's what a Cool Bean said. Rima, they being who? Sigrid says, isn't here, only have Facebook. So Ogun's Iron says, is there any variation among the spike proteins? Can there be much variation? Possibly any change in shape means spike doesn't work. Is focusing on spike protein good idea? So that is the latest discussion after Geert's message as well. So spike protein is the primary protein that the virus is using to bind with ACE2 and enter our cells. With that, it is connecting with TMPRSS2. It is fusing with our cell membrane as well. So spike protein is an important protein for the virus. And I have done a discussion in the past that what happens when the mutations occur and these escapes and selection pressure. There was a discussion I did in the past. So what happens is, if the virus, let's make it very, very simple. Imagine when the parent virus enters our cell and makes a new virus, and that virus is 100% the same as the parent virus, and it has the same potency, it has the same behavior. Then if the virus makes changes to it, and those changes are not automatically, meaning virus doesn't plan it, it's just randomly there are changes in the virus. Fortunately, coronaviruses do not make randomly too many changes because they have a proofreader that tries to correct those changes. So the rate of change is less, but still there are changes. So these are just random changes. It is like this, that if I put 10 stones here on my table and then I take them away and I put them again, I would not make the exact same row. That would have slight changes in it. So when the virus puts its RNA again, there are some mutations in it always. And imagine if that mutation occurred, that the virus RNA genes became too abnormal, or the N protein became abnormal, or M protein became abnormal. Then what would happen is, or the spike protein became too abnormal, then that virus would not even survive. It will be aborted, it would be dead, it cannot work anymore. On the other hand, imagine that a virus has become really bad. It has become very contagious, just like some of the variants. It can bind better now. The spike protein is more efficient, and the virus can enter the cell more in number and then maybe cause more death. Although that is still to be figured out. Because the death is not associated with the virus's activity binding only. It is also associated with the number of viruses that can be produced in a given number of time, so that the cell burst open. And from a virus point of view, you want to do that damage before the immune system wakes up. The problem is that when the virus has a better spike protein, it can enter in the cell fast. But entering in the cell fast doesn't mean that the cell would now produce tons of virus fast. Let's say instead of one RNA, we have sent in 1,000 RNA. The problem is that even if you had sent one RNA, there is going to be RDRP of the virus itself making copies in there. It doesn't need 1,000 RNAs to enter. The main issue is that can you put enough load in the system that immune system just destroys our cells? So that's still something to be seen. But let's assume it, that the spike protein has become better in binding. That allows more viruses to go into the cell, quickly go in, replicate, destroy the cell. So that means a virus can now start damaging us faster and creating a load faster, and that load would be shed faster. And so people would make each other sick faster. But this would only happen if that virus can keep you not too sick for some time. Otherwise, by you, me, whoever, if we become too sick, we'll just drop on a bed or in a hospital, and the virus would then die with us. So virus has to strike a balance where it allows us to roam around in the society so we can give it to others. So that selection pressure of the virus does not bring the virus to a point where virus becomes so lethal that if I get it, I drop dead. If I get it and I drop dead, it's not going to go anywhere. Selection pressure is looking for a balance where it causes enough infection that it can stay on, and it causes enough less infection that I can stay on as well and go and give it to others. That is generally the role of the spike protein mutation, or the way to look at it. Cool. So 7:39. How about we stop for today and we start again tomorrow? Roger Ware says Brazil SARS-CoV-2 P1 Manaus strain lineage carries 17 unique amino acid changes, 3 deletions and 4 and 1/4 insertion compared to the most closely available non-P1. Yes, we have discussed that in the past. So a very good question. Edwin HR says, is it normal for swollen lymph nodes in armpit and neck after Pfizer vaccine? Can you explain why it is not on all people? Very good question. And I crack up whenever I see this. And again, not to the patient, but the way immune system behaves. What happens is, let's say you get the vaccine, and everybody's immune system is going to behave differently. This is why some people would get it and some people will not. But what happens is, when the vaccine enters a cell, and the cell makes proteins, antigens, and the antigens are presented out, and that causes some of the immune cells to become activated, like dendritic cells and macrophages. The immune system now is active. Part of that activity is releasing cytokines that causes local inflammation and local swelling and pain, and some interleukins are circulating and they go to liver and they cause acute phase proteins and cause fever and myalgia and those things too. This immune system's response is basically to make you sit still so that immune system can fight with the virus while you are giving it a chance and not going and having runs and using all the energy on something else. Immune system wants you to just sit down and relax and let me have the energy so I can fight with this thing. Now, neutrophils are some irresponsible guys who can pick up an antigen, shred it, and then just throw it in the lymphatic system. Number one. Number two, macrophages. This is why I crack up. I crack up on these immune cells' behaviors. They're like tiny little cells doing their jobs. And when I visualize them, I kind of crack up. Macrophages pick up those antigens and they run to the lymph nodes. And they say, just like children come to their parents and say, look what I brought for you. So macrophages bring the foreign material, antigen, to the lymph nodes where T and B cells are sitting and say, look what I got. And those T and B cells look at that and say, oh my God, there is a foreign antigen over here. I need to respond to that right now. I need to increase in number. So they proliferate. Proliferation means immune cells respond to some antigen by increasing in number. Now, our lymph nodes are like tightly closed ziplocks. They have very specific inputs and specific outputs. Otherwise, they're closed, they're tight. Now, imagine inside a ziplock, the cells start, increasing in number. That would put stress on the ziplock, on that bag, and there are pain receptors in that capsule, and that causes pain, and that swelling would occur and pain would occur, and we'll feel unhappy and we'll say, what the heck. Usually it is normal. It would subside in a few days, but you should talk with the doctor as well, because it is important with the vaccine. Every side effect should be noted and told so that they can make sure that there is nothing else going on. Immune system always fascinates me, and I kind of like these cute cells. Okay, so Michelle says, ivermectin worked for me. It cleared my COVID pneumonia very fast, and then I didn't get sick when my parents got infected with the new variants. Very good. Ivermectin is great. Anna Strange says, Dr. Bean, you're an extremely gifted teacher. My degree are in comparative literature, but you have caused me to become very interested in medicine and immunology. Absolutely great. That was the plan, to have us become a little more interested in immunology and understand it. Yes, that's exactly what France, that's exactly what macrophages do. This is why I chuckle whenever somebody says my lymph nodes have swollen. I kind of chuckle because I visualize that, all right, macrophages have run to the lymph node and said, look what I brought. And the lymph node inside there, the cells, B cell and T cells say, okay, we're going to proliferate. And that whole thing is happening. Giladoni, absolutely. So generally, what happens is, so the question is, aren't neutrophils the first to attack unknown? The first thing is our barriers. There are two types of our barriers, or attackers or defensors. One are innate arm. Innate arm are non-specific, meaning they don't care who it is. They just do not like anyone, anything from outside. So, for example, our skin is a defense mechanism. It doesn't want anything to get into our cells. So this is part of innate arm. Our GIT, our mucous membranes, these are all innate arm. Then neutrophils, dendritic cells, macrophages, natural killer cells, and the complement system and some other proteins, they are all part of the innate arm. Innate arm is the first responder. So neutrophil could respond first if they are present in the vicinity, which they would be. Macrophages would respond if they are present in the vicinity. They're going to eat up. Natural killer cell can start interacting with the cells that are getting infected or bothered. So there is no, for the innate arm, there is no turn that, hey, first neutrophil has to work, then macrophage would work. Whichever cells are there, they would start working. Dr. Griffin says, I finally got on the FLCCC doctor's list. Very good. I love it. Thank you very much for doing this. Cool. Cool. So let's break for today. We will meet each other tomorrow. So once again, please like, subscribe, and share. And there are 3 links in the description. One is to buy me coffees, another is to become my patron, and the third one is to just support this work. Thank you, and I would see you tomorrow. Stay safe and healthy. I hope I don't offend any of the cool beans. The point only over here is to share knowledge and then go from there. Cool. Bye bye.